Welcome to the iconic talk show in conversation with Dr. Rahul Ved, the founder of Amazing Smile Center. Welcome on board, sir.
Thank you, Niraalee. It's my pleasure and honor to be on such a prestigious platform. Thank you for having me.
Thank you so much, Dr. Ved. Can you kindly share your journey as a micro endodontist?
Right, definitely. So, a micro endodontist is an unheard term. It's now a specialty that is developing in our country. So, we can, so to say, although it's there since quite a few years, but the awareness is now coming into picture. So, it's a long one and a difficult one. Involves a lot of hard work, a lot of number of hours to be spent with your studies. So, as with any course, professional course that you take up, you require a lot of academic excellence to become one. So it starts first with an entrance exam that you appear after your 12th standard, and then if you're lucky enough to crack it, you enter into a dental college where you have to spend 5 years for graduation. So unlike most of the other graduation courses, which may be 3 or 4 years, 5 years is a time period which is relatively longer than other graduate courses as well. After you finish your bachelor's in dental surgery, you need to reappear for another entrance exam which can get you admission into specialty. Endodontics or masters in conservative dentistry and endodontics, that's the complete name for the degree. That's another 3-year program. It's one of the branches that is now available to do masters in dental surgery. So now we have 9 branches in dentistry in which you can do a master's in.
It's a specialization.
A specialization. So after we complete that 3-year course, so you've already spent 9 years after your 12th standard. That is assuming that you have cleared all your exams in your first attempt, which may not happen. Unlike other courses, we do have a KT system, but it's really not that beneficial because we are not allowed to keep so many subjects. We study about 22 subjects to 21 subjects in the course of these 5 years. And we have annual exam, and if you miss the bus in any of the exams, you are back by 6 months. So this 9-year journey is the quickest time period in which the journey can be completed to get your qualification as a master's in endodontics. Then a micro endodontist is a person who further pursues and explores his specialization more to work under a machine that is called as a dental operating microscope, or in other words, it's a magnifying device. For the simplicity of it, is basically a magnifying glass, but a very high and highly sophisticated magnifying glass, which allows us to see things that are otherwise seen with the naked eye, depending on the power of the machine, anywhere between 7 to 25 times larger. So because we are working in a very small area, can you imagine working on a tooth and an area or an organ which is located inside the tooth? So how small, thinner than a hair strand is what we work on. So the more better we see, the more better we deliver. Clarity. It's all about having good vision. So in turn, it's the patient who benefits, because if we can see better, we do our jobs better.
You can share how you started the Amazing Smile Center.
Right. So the Amazing Smile Center, it's like a baby for me. I'm very proud of the kind of practice me and my wife both run together. Her name is Dr. Utsavi. So we work as a team. I handle the root canals and the other associated problems with it. So basically, in simple word, I make sure the patient is pain-free, right? And she handles the rehabilitation of teeth that I've worked on, and the other aspects of dentistry which are commonly known. For example, you get your teeth cleaning done, or you get your extractions or your crowns or whatever it is. So the Amazing Smile Center caters to every dental need that is possible, including with the support of a esteemed panel that we have. So we have specialists available, as I told you in the beginning. For every branch of dentistry that is available, there's a specialist there on our panel. So the best person of the job should touch the patient is the new concept we feel. Unlike the traditionally, dentistry is a concept in which one clinician tries to address all the problems the patient has. But now the science has evolved so much that we also know of many more problems than what the dental fraternity knew about 30-35 years back, So we want the best person to touch the job, to do the job and touch the patient in whatever is their requirement. We also have a very unique concept in our clinic, that we have an in-house art gallery inside our clinic. So if you walk into our clinic, you don't see any pictures of any tooth or any kind of blood pictures. No, there's a good ambient lighting, good music going on that soothes you, because 8 out of 10 patients enter in pain, and there's an art gallery which the patients can visit and know more about, because we also have a resin art business going along in the clinic as well.
What an innovative concept.
Yeah.
And this is a healing concept.
Yes. So music as therapy, colors as therapy, and then whatever the clinician performs
So
to
what
elevate the
holistic
dental
way of approaching your patients.
Yes, definitely. So you get a holistic approach.
Absolutely.
Our aim is
360 degrees
yes.
holistic approach.
So half your problem should be solved when you're sitting in a waiting area before we actually work anything, because the maximum hindrance which we face as clinicians to deliver good dental treatment is the fear of the patient. If you are afraid of something, you are not putting all your efforts into it, right?
True.
So our success is very much dependent on our skill, yes, but I don't think we should brag much about our skills, because the cooperation of the patient is what allows us to deliver the best we can, right? So we should put in all our efforts so that the patients are comfortable, and in turn they can cooperate with us, so they benefit the
I
maximum.
love the unique selling point of the Amazing Smile Center.
Thank you.
It gives a 360-degree holistic approach to
Correct.
the patients,
Correct.
because it's therapy mixed with,
Right.
when they're waiting out there in the waiting lounge
Right.
for the doctor to come on board.
Right.
There is absolute therapy with,
Right.
colors and sound
Right.
playing on the background.
Right. So yeah, that was the whole concept of the clinic. Also, we work, of course, if somebody is in a lot of pain and all, we attend to them immediately right away. But our clinic follows a very strict appointment system.
Right.
We don't want anybody to sitting in our waiting rooms. Everybody's time is precious,
True.
right? If you really want to deliver, because we focus on minimal visits and maximum treatment. So that is the reason why our duration of visits are relatively little longer, right? Otherwise, patients generally perceive going to a dentist, entering and leaving in about 20 minutes, 35 minutes and 30 minutes. But then they have to do multiple visits. So we prefer the patient to come once and get maximum job done. So that's how we feel everybody's time is precious, Finding out another half an hour extra when you already left your house is far easier than trying to leave your home multiple times to solve one issue, right?
Right.
And city of Bombay,
The traffic.
time is everything, right?
Absolutely.
Time is everything. So we must value each other's timing. So we try our level best to make sure our waiting room is empty. But please don't feel that we don't have work because of that. It's just that we don't want anybody to be waiting. So we plan our day that way. That's the concept of the clinic. That's why it's amazing, right?
Absolutely.
Right.
I love your concept
Right.
of having an art gallery coined with the Amazing Smile Center. What an innovative concept.
And on our free days, the center also functions as an education hub.
Okay.
So if you see our tagline of the clinic, it's dental health, art and education. So the education aspect is taken care of by me and my other team of educators, where we try and hold hands of young clinicians to take this step into advanced treatment modalities. Because I was lucky enough to be a specialist. Not everybody has the means, be whatever reasons. The reasons could be practical or otherwise as well. To get the opportunity doesn't mean they cannot deliver best for their patients. Unlike a corporate culture, we don't believe in saying that we are the best in everything. It's frankly doesn't make. I don't find it true. How can 10,000 people be best? Best is one. That's the definition of best, right? But we want the patients to get the best they can wherever they are. Not every patient can walk into a clinic, right? But through the modality of education, wherever our students go and practice, they will deliver the best, right?
Right.
So we are a part of those patients' lives as well, although
Empowering
indirectly.
lives.
Yes, although indirectly. But yeah, that's the concept of the place.
Lovely. What is an endodontist?
Right. So an endodontist, in simple words, is a clinician or a dentist who specializes in doing, in simple language, what everyone knows is a root canal treatment, right?
Right.
As I already took you through the academic journey. So he's a person who's now dedicated his life to solving that one particular core issue. Now, why does it become so important? Like day in, day out, I am performing this one procedure in a very broad sense. Of course, there are very umpteen technicalities involved, in the same person as well, the procedure may go smoothly, the procedure may not go smoothly. So there is a lot of factors, which is like a very academic discussion meant for the academic podium. But by and large, it's a clinician who dedicates his time and his life to trying to keep dental patients pain-free. That is what or who an endodontist is, right? The reason being, in general, if you see social media, you see print media, you see any kind of modality by which any person can create awareness about their profession. When you talk about a dentist, it's generally people feel it's a clinician who is either keeping the teeth aligned or making their smile look beautiful, right? That's just the cosmetology part. If you try and go to the grassroots of it, you will find 8 out of 10 patients entering in a dental clinic, be it in whichever city, be it in the most remotest village of India, or be it in the most affluent societies of India, they will enter when they have pain, right? So an endodontist is the person who caters best at elevating your dental pain through a root canal treatment, that is provided it is indicated. I mean, there are a couple of options when you come into a clinic as pains. You come into a clinic with pain. It's either a filling or a root canal or an extraction. So these are broadly the 3 options that you have, and the decision lies completely with the clinician as to what is to be done. It's of course up to the patient to accept his advice or no, and that's the complete right as a patient. They like their opinion, they want a second opinion, third opinion, whatever it is. But these are the 3 treatment modalities that you will come across. So our specialization covers 2 of them, which involves, if you see the qualification, it's Conservative Dentistry and Endodontics. So Conservative Dentistry is basically all to do with different kinds of fillings, and Endodontics is basically dealing with root canals. So yeah.
So when you spoke about root canals, what are the myths surrounding a root canal treatment?
Right. So if you are in a party somewhere in your friend circles, and if your friend comes up to you, I'm not able to enjoy my party, I'm having a lot of pain. So you'll say, I also had it 6 months back, but I got a root canal done, and immediately the face turns white. They are scared. People by and large, about 80-85% of the patients, before they begin their root canal, they are scared, right? There's little we can do about it before they come in touch with us. Our job is to make sure that they're not scared for their second root canal, right? So their experience should be that good. So the first myth that is surrounding a root canal procedure is that it's very painful. Certain stories pan across, be it India, be it rest part of the world. Grandma stories always percolate, right?
Absolutely.
They may be relevant. Yeah, the effect always carries on. They may be relevant in today's times, they may not be, but there is little you can do about it, right? So yes, we all also accept about 40 years back, when the science of endodontics was young, it was definitely a little bit of a painful job. I mean, we don't deny, because anesthesia was also not that developed. Right now, anesthesia helps us. It's so nice, so easy to give. I mean, our patients are very comfortable. They even hardly feel the needle prick. So anesthesia helps us in keeping the pain factor in check. A lot of options for anesthesia available. That has helped. That science has developed. The science of the procedure per se, how we perform our root canals, that has evolved. So I think there is no reason for anyone to be afraid of it, because they often say that fear and negligence in dentistry is what makes dentistry expensive. Because if you are afraid, you will not go. You will not go, then things will percolate further, then things will get complicated. And then you have to rely on more expensive treatment options, right? So that is the first message I would like to send across. Don't be afraid of us. We are your friends.
Absolutely.
Right? So it's important that mothers don't scare their child. If you don't keep your hygiene maintained, I'll take you to the dentist, and the dentist is very scary. So it all starts from childhood, right? So that conditioning should be avoided. He'll take you to your friend and he'll solve your problem. We rely on friends, to solve our issues. After a certain age, parents are out of pictures, and then it's all about friends, right? So your dentist is your friend. So that is the first myth that I would like to bust. Second myth is that it's very time consuming. Right? Traditionally, the science of endodontics, I agree, was very time consuming. Now it has evolved. Technology has penetrated every industry in this world, be it our house, be it our clinic, be it the IT sector, finance sector, you name the sector, it doesn't run without technology, right? So now success in every field is dependent on establishment of good technology and then the technical acumen to use that technology, right?
True.
So it's come into our field as well. So we are not obsolete from any such kind of global changes. And unlike perception that India may not be so technically at par, I think you should visit our center. We are at par with anyone in the world, I feel. So there is no reason why Indian patients should not get the best. So these are the two major myths that I would like to break, So to say that it's not painful.
Absolutely.
And it doesn't take a lot of time. And yes, the teeth do survive. So it's actually the best option because you cannot replace what God has created.
Right.
Any part of the body, we will be very reluctant to remove, right? If you have a pain in your hand, you will not think of chopping it off, right?
Right.
You will try of thinking getting rid of the pain as to whatever the cause is. But when it comes to dentistry, people are very relaxed because God has given us so many teeth. You feel the loss of one tooth doesn't actually cause any kind of damage, but you must ask the patients who have suffered. So just because you or your family member may not have suffered doesn't mean that there are others who are not, right? So a loss of a tooth can go into simple disability to chew properly, right from giving you issues in your neck muscles to your back muscles. So sometimes if you feel that with all physiotherapy, with everything, with your neck is still stiff, please get your teeth checked.
Right. So can you kindly share the evolution
Right.
for a root canal treatment?
Right. So before we try and understand the evolution of a root canal treatment, we must have a basic idea of what the procedure involves. Okay. The first
Right.
procedure it involves is getting a diagnosis done, right? Yes, I'm having pain because my root canal is affected. That's the first step. Then the patient comes into the operatory after they've done all their x-rays and we are now
Right.
good to go, right?
Basic examination.
Basic examination is done. Then we come into the anesthesia part of it.
Right.
Once the anesthesia is given, you know now that the patient is comfortable and is going to allow you to enter, because we enter with so many machines. It's a little scary because the main difference between any dental procedure is not just about root canals and other procedures performed in the body. The patient is always conscious.
Right.
Asking to be done under general anesthesia is too much of a demand. You cannot because you cannot take general anesthesia so lightly. I mean, we don't see the need for it. Post that, then we begin with whatever job is to be done. Basically, in simple language, it involves some amount of cleaning and some amount of filling, and there is a healing curve involved. So there's a basic construction or a deconstruction of the process, the root canal treatment. Every step of it has now evolved, like the facilities for the x-rays and the way we see things, Technology has played a very important role. So a microscope helps us a lot, seeing finding out the cause as to why the root canal has got affected or why the patient is having pain, because it may not just be simple decay. There are a lot of times where a lot of patients have very small cracks because of which they get pain, which are not seen even on the x-rays, that only the machine can see, right? So then the treatment line changes completely. After that, we have a good amount of devices which help us do a job much better and much quicker. Like out of 100 cases that say I would do, I finish about 80, 85, probably 90 of them in a visit. That's with the filling, and then they are home ready for their cap and all. So that's a 2.5 hour procedure, unlike traditionally trying to call them for about 3 visits, 4 visits, and then work every time for half an hour.
So it's completed in 2 hours now?
Yes, we finish our root canals in 2 hours, start to finish, everything.
So one root canal will take 2 hours, start to finish?
Yeah, that's what we call the single visit concept.
Oh.
You're done, your job is over in 2 hours and you're on to the rehab phase.
Right.
Because the patient basically comes for a rehab, right? But because he's in pain, you can't do the rehab so soon, right?
True.
So the root canal forms like a foundation for the whole building to be built on, right? If your foundation is not good, and then if you keep building up your floors, ultimately BMC will come and put a sticker as dilapidated, right? Not safe to stay. So if your root canals are not in place, your tooth it's difficult for the tooth to survive, right? So if you really want the tooth to go a long way, go with you to the grave, your root canal has to be sound, and it's possible, right?
So what is the evolution in today's world with the root canal treatment, which you've seen in your practice?
Right. So the evolution that I have seen is the time taken.
Right.
First,
Okay.
So that has drastically reduced, because for us the time taken as clinicians, we don't feel the amount of time the patient spends on the chair. That is important,
Right.
but that's a secondary factor, in the sense we can give the patient a break if they get tired because they're opening their mouth and stuff like that. But now in the modern era, to call them again and again, that's becoming a problem. So we have reduced the number of visits and we've made it pain-free.
Right.
So I think that's the biggest evolution you can get. I mean, if anything, that allows us
that. Has played a very important
Yes,
role in the field
100%.
of dentistry, and of course with your micro endodontist
Yes.
niche which you have.
So now dentists have become a combination of an engineer and a doctor, because you need to know the machines as well, right?
Right.
So we need to know how those machines are working, and it's become 50% skill, 50% technology.
Right. Can you kindly share what is the most important thing as an endodontist you can do to protect oral hygiene?
Right. So I feel the first change we must bring about is try and encourage our patients to visit our clinics once at least 6 months. In general, awareness about health in our country is increasing, but still there is a lot to be desired. I mean, as much as the awareness is increasing, the obesity index is increasing at double the rate, right?
Right.
So that's never a good sign. Lifestyle plays a very important role even for the oral hygiene as well.
Right.
So it's very important to be healthy first of all. You cannot consider the rest of the body as separate and then the dental apparatus separate. It's inside your body, right?
True.
So anything that affects any other organ in your body will affect your dentition as well.
Right.
And so it's very important to have a good lifestyle. Oral health should be a part of your lifestyle. Like, we would want always our hair to look nice.
Right.
We would always want to be fit, right? At least some people are able to achieve, some people are not, but everybody desires, right? So at the same time, you must always put in efforts to have a good oral health as well, right? When we try and do our checkups, because I do my checkups also under the microscope as well. It's not like I'm just day in day out just doing root canals under the microscope. They help us in diagnosing those very small cavities. The beautiful thing about a microscope is that even the patient can see. So unlike in a conventional practice, if you try and enter into an operatory, the doctor does his best,
Right.
He sees everything and he advises you. And then by and large, the patient takes it as a piece of paper and forgets it. Then when we go into our history and the patient has come back, say he's got a checkup done today and they come back 2 years later on, and we say at that time the cavity was very small, but now today it's landed up into a root canal. Why? Because although you were advised, but you didn't take it that seriously, and now that decay has increased and it's causing you pain, right? So the microscope records everything that you do. So there are photographs, there are videos. All that we need to do is turn around the screen and let the patient see. Even if we are quiet, the patient sees that, boss, there's something there. Let me just get it done. So it creates a big impact as far as maintenance of oral hygiene is concerned. Also, I think gum health should also be given equal importance. That's something which not enough awareness is there, because everybody feels brushing twice a day is the end of it. It's really not that simple.
True.
If with basic lifestyle changes, everybody would be disease free, we would live for 400 years, right? But human body is like that. It is fragile. So we need to take more steps to take care of it. Good amount of gargling is very important. Nobody does enough of gargling is the feedback I get.
Right.
And I think reasons like my work culture doesn't allow me, or I don't have time. You don't have 5 seconds to gargle your mouth. It's a little difficult to digest.
Right.
I don't know whether it is genuinely true, because I'm not in their place day in, day out with them, but this is the feedback we get. Right? Also, the kind of food we are consuming is very important. Stay away from refined foods. Right?
It's so difficult.
Very difficult.
To convince the millennials and the Gen Z to stay away from refined food in today's generation.
I mean, it's too impractical for me to say that please don't eat chocolates. You are going to eat.
Absolutely.
All that I can say is please eat whatever you want to once in the day and gargle off your mouth, and that's the end of it. Right? The habit of eating something frequently is what causes more issues.
Right.
The quality of what you're eating is a secondary factor. The frequency is a much more important factor, because within the first 10 minutes, if you don't gargle, that's when the problems start.
Right. Absolutely. You recommend gargling after every meal?
I recommend gargling every time you put something in your mouth.
Absolutely.
Right.
Okay, what are your 3 tips which you would want to just sum up for the millennials to maintain their oral hygiene
Right.
and just have a barrier to save their teeth?
Right. 3 most important tips is that first and foremost, please consider it as important. Don't consider it as something secondary for your health,
Very
because
well said.
you will be surprised as to how many health issues arise simply by things what you're putting in your mouth and then they're staying there, right? Because this is the gateway to your body. So it's not going to stay there. It's going to percolate all throughout your body.
Right.
Second is, please visit and get a checkup done every 6 months. Is very important, right? Just ask your doctor if everything is okay.
True.
You'll be very happy to know that everything is okay.
Yeah.
And if things are caught in a nascent stage, in a younger situation, we also can treat them far easily and far better. It's easier for us to do a filling than to do a root canal.
True.
Far easier to do a filling than to do complicated extractions and then try and put an implant in that place. The procedure becomes so big, no?
Right.
We are also happy doing 100 fillings a day than doing 4 RCs a day. No, it's the same thing for us. We are there to deliver whatever treatment the patient requires. Very easy for the patient, the healing curve. And the third thing is that, as I said, maintain a good lifestyle. It will help you in your oral hygiene as well.
Thank you so much for sharing these tips
My
with
pleasure.
our audience.
My pleasure.
And thank you so much for being our guest at the Iconic Talk Show. It
My
was an
pleasure.
honor to have you on board, Dr. Ved.
Feelings are mutual. Thank you so much.
Thank you so much.